Namaste, I am Dr. Vatsala, obstetrician and gynecologist at Cloudnine Thanisandra, Bangalore. Cancer screening. So, in India, the cancers are on the rise in modern day. The cause being the lifestyle changes, the genetics, and also the environmental factors. So, among gynecological cancers, cancer cervix, cancer breast, cancer endometrium, and cancer ovaries are common among women. So, cancer cervix. Cancer cervix, did you know 65,000 Indian women die of cancer cervix every year? The cause of cancer cervix is the HPV, the human papilloma virus. So, cancer cervix is preventable and treatable. So, we do what we call as screening. So, what are screening tests? Screening tests are tests that are done on women who are asymptomatic to detect diseases. So, for cancer cervix, we do the Pap test. So, if Pap test is done, it's done once in 3 years. When a Pap test is done with the HPV DNA test, we repeat it once in 5 years. So, what is the age of screening for cancer cervix? It is between 30 to 65 years. So, on these Pap tests, if any pre-cancerous lesions are detected 7 to 10 years prior to the onset of cancer, it can be treated. So, by screening, we can detect pre-cancerous lesions, and on treatment, we can prevent the cancer cervix. Cancer breast. Cancer breast, the screening tools are: one is the self-breast examination. A woman is supposed to examine her breast every month, a single day, when she doesn't have her menses. So she can divide her breast into 4 quadrants and examine for any abnormal lumps or swellings or any discharge or any skin changes. If so, she can contact her doctor. So the next screening test is for women after 40 years. We do what is called as a mammogram. These are X-rays, low dose X-rays of the breast, and nowadays sonomammogram is done, wherein with the mammogram there is also an ultrasound correlation. However, for women who have a genetic predisposition, who are positive for this BRCA1 and BRCA2 genes, here we start screening at an earlier age of roughly around 25 years. Cancer endometrium. We actually do not have any particular screening test for cancer endometrium. However, for women who present with postmenopausal bleeding or bleeding issues post 40 years, we subject them to transvaginal scan, ultrasound, and do a biopsy if needed. Cancer ovary. Again, there are no particular screening tests for cancer ovary. However, after 40 years, a routine yearly ultrasound, transvaginal scan to look at the health of the ovaries and also a CA125 would help us to detect early cancer ovaries.